You're listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello, and welcome to the Oncology Nursing Podcast. I'm your host, Stephanie Jardine, Oncology Clinical Specialist at ONS, and today we're talking with Mateo Benegas, Associate Professor of Radiation Medicine and Applied Sciences at the University of California, San Diego, and a member of Moores Cancer Center's Cancer Control Program, about COVID-driven financial hardships, financial toxicity, and cancer care. Mateo is presenting about the topic at the 47th Annual ONS Congress in Anaheim, California on April 30th. You can also earn free NCPD contact hours after listening to this episode and completing the evaluation we've linked in the episode notes. Thank you for joining me today, Mateo.
Hello, thank you all for having me.
So to start us off, I mentioned in our introduction financial hardship and financial toxicity. Can you tell us, is that the same thing or are those different ideas?
What we've seen, in studies and in the literature and just in the field itself is that a lot of individuals use different terms, words, to describe a very similar phenomena. Some people use financial distress, financial hardship, financial problems, financial toxicity. I think this is really a term that's been used more within the oncology space, arena. And I think it was really put forth to increase the recognition that it can be considered just like other physical toxicities that arise from cancer treatment and the expense of cancer care, that this financial impact or financial toxicity, as they say, is something that we need to both recognize, identify, and address. And so I think of it as the same thing, just a different word. But again, I think this is more of something that was really done just to increase that recognition.
Thank you for that. I think that it's interesting, as you mentioned, how the financial piece for patients with cancer was termed a toxicity, and to bring recognition to it with all of the different treatments and the expense of the treatments that patients do experience in their cancer journey. And I think that the word has really brought that to the forefront, but we're going to just use financial hardship through the rest of our talk today. But I appreciate you explaining that and just kind of getting us all on the same page with the terminology. Can you talk a little bit about how common financial hardship is for patients with cancer?
That's a great question. It's also kind of a hard one to answer. And the reason I say that is because from the studies that we have seen so far in terms of, our evidence, if you will, from the field, the estimates that have been reported, they vary so much, from around the 20% region, some all the way up to, in the 60% region. And I think what's really driving that variation is that each study is able to work with a unique and important population of patients. And so some of the higher estimates, let's say like in the 60s range, I think it's those that are often, let's say, have lower resources, maybe both personally, like lower finances, but they may also be, in a community that has lower resources as well. And so all that to say, it's really hard to put our finger on a specific estimate. But I will say that the closest that we see is estimates from national studies based on national surveys, I should say, like the Medical Expenditures Panel Survey, that suggests that it ranges anywhere from about 1 in 5, so 20%, all the way up to about 33, so 1 in 3%. I'm sorry, 1 in 3 individuals. And again, it'll vary based on the age of the individual, but it's in about that range. If I would say again, 1 in 5 to 1 in 3.
That's significant for the number of patients or the number of people who experience cancer in their lifetime.
Absolutely.
So, with that being the number and thinking about how many patients one oncology nurse might take care of in her shift or in her day or in her week at her job, she's definitely going to see at least one patient, if not more, that could potentially be experiencing financial hardship. So, for those nurses who are listening, what might be some warning signs that the oncology nurse could identify or watch for in their patients related to financial hardship?
Yes, it's such an important question. And what I would say, just to start is I feel like nurses have such a rich opportunity because they're often the ones who get that personal interaction with the patients. It's often that the patient feels very comfortable with the nurses. And so it's an opportunity where they can share some of these things, some of these concerns or some of these questions, which they may not be as comfortable sharing with the oncologist or their other providers. So I just wanted to make that point again. I feel like it's such an important role on the healthcare team that the nurses are often the ones that kind of get that first exposure to it. I will say that what we've seen is that the patient will ask certain questions or they'll make certain comments about, can you tell me a little bit more about how expensive the care is going to be? Or what would happen if I didn't get this medication today? Or could you tell me, are there other options that may be more affordable? Things like that, kind of those questions or the comments that express maybe some concern about the cost related to their care that may kind of point to an issue where affordability is at the top of their mind. And then I see, let's say once they're within the care pathway, things where they're skipping some of their appointments, or you can see that they haven't filled or picked up their medication, or maybe they're delaying some of their care. Those are some of the telltale signs often that, one of our patients might be experiencing some financial hardship.
Those are some good things for our listeners to watch out for or listen for whenever they are having those conversations with their patients. Can you tell us what barriers to cancer care do financial hardships create for those patients?
So the type and the severity of barriers that are created by or even exacerbated by financial hardship are endless. These barriers, they not only impact but they can range to all parts of our patients' lives. However, if we think about specific barriers to cancer care itself, this could include things like disruptions to health insurance coverage, again, inability to pay for their care, or if they've already received that care, let's say inability to pay for medical bills, right, which could, kind of impact future care. There are some individuals who make cutbacks to spending on their medical care, right? I mean, they're trying to balance, let's say, spending on their everyday needs versus their spending on their medical care, whether it's a prescription or, an upcoming appointment. And then kind of like we touched on just a second ago, missing or skipping or delaying their treatments, some of their cancer care or their medications. I would say those are just a few of the barriers to cancer care itself that financial hardship can create.
Thank you. So, these last going on 2.5 or so years have been definitely difficult for everyone. And cancer care and the treatment are expensive, but then, you throw in these outside factors like the COVID-19 pandemic, and you've got a lot of additional hardships for patients. How has the pandemic specifically increased financial hardships among patients with cancer?
Another great question. I think that we're just now starting to see findings from studies that are specific to cancer patients. And as you'd expect, while there's not a lot of data out yet, we do see that individuals with cancer did experience greater financial hardship than, let's say, a general population. But just as you mentioned, I think it's something that across the country, the COVID pandemic really resulted in significant hardship, right? We had millions of people who lost their job and who remain unemployed, throughout a large part of that time period. And, we saw individuals with considerable unmet need, towards still the end of this last year, 2021. And so, I think if we look at the big picture, right, we know that I think it was about like 6 million people or something close to that reported to lose their jobs during COVID. And we also know that a lot of those individuals enrolled in public health insurance, right? So like Medicaid, things like that. And so those are then kind of trends that are important for cancer and for cancer care because, those really influence, again, access to healthcare for these individuals. So circling back now for people with cancer, right, it's already challenging to balance both work and this disease. It's often where we see individuals with the cancer diagnosis have to take time off from work. They have productivity loss, all can lead to loss of income or loss of a job itself. So the fact that this was already happening outside of the cancer experience itself really suggests that it could be more challenging for this population to continue to afford the care that they need to address this illness.
I'm sure, like you say, just the stress alone of the cancer diagnosis and what that treatment is going to be. And then with the pandemic and whether it was the patient who may have lost a job or, a family member that they were on their insurance and all of these things that, our patients have to think about and then worry about as well. And some of the other things that we haven't mentioned yet, and we might get to them later on as well, but even the other financial expenses that they have in their life, whether that might be childcare or it might be the electric bill and those kinds of things when patients are trying to look at what takes priority for them.
That's right. And I love the way that you frame that. It's such an important thing I think for us to touch on is that I think what often happens is that when we say financial hardship associated with cancer or things like that we often just think of the monetary impact of the cancer itself, right? And the financial hardship associated with the care. But for most individuals, right, like all of us, we have to balance these everyday needs in our life. And so financial hardship can also be experienced or manifested, right, in the other forms that you just mentioned. Childcare is huge, right? And for individuals, let's say, who don't have a large kind of social support system, or they're in a rural area where there's not a lot of childcare resources around, or there's not a lot of transportation around, right? All of those things can lead to or can represent financial hardships as well, right? If the person doesn't have the money to get to their appointment, their chemotherapy appointment, or their kind of follow-up visit, that's such an important thing. Or if they don't have the opportunity to have someone come and watch their child while they go to a chemotherapy appointment, things like that, they're just like, I can't emphasize how important it is for us just to kind of voice things, that these are realities that our patients face and that we often don't, I think, voice enough.
Exactly. I think those are all such important things that we have to remember when we are working with our patients. And, whether we're helping them navigate that or there's someone else that does that. And speaking of navigation, can you explain the term financial navigation for us and who might actually be the person doing that?
So financial navigation is what I would consider the coordination and the provision of individualized, personalized resource assistance that that aims to address and reduce the financial barriers of our patients with cancer, their families, or their caregivers too. And in terms of the question about who, I don't think we've really answered that question yet. And the reason is I think there are so many different types of health systems or health clinics where the structure of these systems are so variable. Each is so different that each system might have a different solution, right? Or a different individual who wears that hat. And so I think the current work that we're doing right now in the field, I would say we're right in that space right now, trying to understand what does financial hardship look like across, these different health systems, who in these different studies or let's say programs are taking on that role, and what are they doing, right? How are they operating within the context of everyday clinical flow? So there's some really important questions that I would say, the field right now is looking into and trying to find some answers to.
I think those people are going to be very important to all of our patients. For patients who are receiving help from a financial navigator, what types of things are they helping patients with, and how do they manage that with a cancer patient?
Ideally, the financial navigators is someone that we can consider like a primary provider who's really working to address these financial concerns of the patient, but who's really centrally responsible as the individual who's helping to coordinate, to communicate, and to document how they're working with the patient to manage these financial questions. And so this means working with all healthcare team members, whether it's another clinician, another nurse, a social worker, or the pharmacy. Again, really trying to coordinate all the key pieces and resources toward addressing the individual need or concern that the individual patient themselves may have. So, for example, traditionally, when we think of a patient navigator, right, they're really the ones who are guiding the patients one-on-one through the aspects of their care, whether it's coordinating with another provider or helping to set up an appointment or interacting with an insurance company. This coordination, right, is really what's key. And it's that warm handoff that I feel like the financial navigator within this arena can really help. And what's unique to oncology, I think, is just kind of the multimodal care that these individuals may receive, right? They may be receiving radiation therapy, followed by chemotherapy, or some at the same time, or maybe it's surgery, right? There's so many different types of treatment and areas of the healthcare system that these individuals may not only have to encounter, but try to navigate, each which has its own unique set of expenses. The financial navigator, again, can really serve as that primary provider to both try to guide the patient to the resources, but also to make these referrals that hopefully can reduce some of their issues.
It's so good to have someone that is looking at that and looking at those referrals for patients. I can remember when I was in clinical practice, and if we had patients who were having difficulty in, let's say, finding a ride to their appointments, or it could be something like, an electric bill or a gas bill, something like that. We had a social worker that was very involved with our program who did a lot of those types of things. But I think it's so important for nurses, wherever they're working, to know who those point people would be for the patients, because they might be in a small physician run clinic that doesn't have access to a social worker, or they might be, in a very rural setting. Sometimes, or most, I would think most of the times in the larger academic centers, they have access easily to a social worker or maybe even a financial navigator. But knowing who those people are is going to be so important for the nurses. that are working with our patients.
I couldn't agree more. Myself and Dr. Nora Henriksen at Kaiser Permanente, Washington, we have currently a financial navigation trial that the acronym is CAFE, right? And so it's one of the first trials that's really in this space, like you and I are talking about really trying to understand what is financial navigation, what's the impact of it on individuals with cancer. I bring that up because for the first year, we had basically it was a planning year. And what we did as a study team and as our navigators for the study is we really just reached out to the system and did exactly what you said, asked questions about who's doing what along this whole pathway. Like you said, is it a social worker? What are they doing? Does the system have existing patient navigators? Okay, well, what do they do? We spoke with, I can't tell you, tons of different departments and groups across the system just to listen and to learn. What's your workflow? How does it relate to addressing a financial hardship or a financial question? And all of that we then used to create kind of these unique workflows, right? So for our financial navigator to say, okay, if I have someone with this question, who do I need to contact? And I think the benefit of that process was huge because, it enabled us to to build these relationships with these individuals, right, across the health system, to your very point, so that whenever the financial navigator was encountering a specific issue, they knew exactly who to call. They knew the person because they had met with them, they spoke to them, they knew their number. But more importantly, that person knew our financial navigator, right? So they're more likely to pick up and to say, okay, yep, this is what we talked about. This is the workflow for that. So it really kind of created us almost like a workflow, or again, a map, if you will, for us to really know exactly how to address, or at least attempt to address this financial issue, because we had kind of done that our homework, right, to really understand what's the ideal process in our system for meeting that type of need.
That's so interesting. And what a great way, like you said, to see who the players are on the team and what their role is. So you mentioned that was a research study that you did. Are there other research studies going on that are measuring the effect of financial hardship as well as the effect of financial navigators with patients?
Yes, so there are, I would say, a handful right now of funded, I should say, of studies, of trials that were recently funded by the National Cancer Institute. And I would say this is the first group of large funded projects that are really trying to answer this very question. The beauty of it is that, thankfully, each of us who has a study, we know each other, right? Where it's very collaborative. So the goal is, as these studies continue, that we'll learn from one another and really trying to collectively, be able to inform the field about what works, what doesn't, how each of us were able to kind of operate, within our system. And again, one of the important things is that each of these studies is a little different, as you could imagine, not only geographically where they're located across the US, but the patient population, right? And like we mentioned earlier, kind of the structure of what the financial navigation looks like within their health system. So to answer your original question, yes, there are, again, a group of trials ongoing right now that are trying to really find at least some answers to this question of, does financial navigation work? How does it work? And are there key components of financial navigation that might be more helpful for certain populations?
With any research study, there are certain factors that make a patient eligible. With these research studies that are looking specifically at financial hardship, what types of factors are they looking for or looking at with these patients?
Again, it's so variable just because, each study is structured a different way. But I can say that most of these studies, thankfully, have a nice broad inclusion criteria, let's say, right, where they're really trying to enroll individuals in these trials who from a broad range of individuals with cancer diagnosis. So, for example, compared to, let's say, a study who really focuses on patient populations that has advanced cancer only, and not only that, but let's say a single type of cancer. The trials that we're seeing right now, they're open to a broad range of different types of cancers and to a broad range of groups of patients that are not necessarily a particular income range or anything like that. And the beauty of that is it really enables us to kind of approach this issue and try to answer this question broadly, right? To say that we know that different scenarios create different financial hardships for our patients. And so for us to be able to even start to answer this question, we have to understand not only what are the types of financial hardships that these different individuals are experiencing, but from the planning standpoint, from financial navigation, how is it helping these different individuals? So those are the kinds of opportunities, right, where we want to be able to say, okay, well, as a whole, financial hardship really just had, let's say, a marginal impact overall. But when we look at these different populations, or let's say subgroups, we find that, yeah, it was most helpful in this particular group. So I see these, let's say, broad inclusion criteria as a great thing for us as we really just start to answer this research question.
Mateo, thank you so much. This has been such a pleasure speaking with you today. And I'm personally looking really forward to the session at Congress and learning more and hearing more what you and your other co-presenters have to say on this topic that really is very important to our patients and so important for the oncology nurses to understand. We're getting close to the end. And as we do, I finish all of our podcast with a few questions for you. And I'm going to start those right now. And we're just going to go through them in a real quick fire manner. So the first one that I have for you is, what are common misconceptions about financial hardship?
Individuals often think of, financial hardship is just for individuals who are lower income, or let's say, who Medicaid only, things like that. But that's such a misconception because income operates for each of us a little differently. You and I may make the exact same amount, but our life situations are different. And so I may experience financial hardship to a much greater extent than you. And so, again, as we move forward with this field, it's something we have to recognize that it's not just about income. It's really about an individual's complete life situation that we must understand to really work with them to address this issue.
Thank you. The next question: what's something that's not often discussed, but you wish people knew more about with financial hardships?
The first thing that comes to mind is exactly what we discussed a little earlier, in which you articulated nicely, is that financial hardship comes in different forms, different shapes and sizes, as they say, right? To where it may not be just about the monetary impact, or right, about the kind of the impact on our wallets, right? It could be the distress that hits our patients because they're worried so much about how they're going to pay for their next super expensive oral anti-cancer drug, something like that. It could be the behavioral piece, right? Where people are having to spend all of their life savings just to afford their care. So again, it's just that financial hardship is so variable that, again, for us as let's say as a team really trying to work to address this issue, it's really trying to ask questions that help us identify how is it different for each of our patients. That'll really enable us or kind of prepare us to work to help our patients in the best approach.
What additional training or education could you suggest for oncology nurses who want to understand and provide resources on financial hardship to their patients?
Sure. I would say, really trying to understand health insurance. It's something that I think even those of us who are, I guess, more steeped in this have difficulty. Health insurance is so complex. And so even just understanding the common terminologies, right? Out of pocket costs, the deductibles, the co-payments, and let's say how each of those kind of operates to impact the particular out of pocket costs for our patients, what those out of pocket costs may look like, some of the resource within each of our own systems that we might tap into to identify, okay, well, what's the out of pocket cost for this encounter for our patient? How can we find that information? Who do we need to speak to try and get that information for them? Also, just about overall having this cost of care conversation, really trying to build that in within the care workflow, right? I realize that often within our healthcare teams, we're already trying to crunch so much within that encounter, but really trying to find and create those opportunities to have those brief conversations with our patients. Again, whether it's just asking one or two questions or, trying to keep an eye. I like how you framed it earlier. It's really listening for some of those key issues or some of those key words that might kind of point or kind of highlight to say, I think this person might be experiencing or might be at greater risk for experiencing this financial hardship. Let's make a referral to the social worker, let's just say, something like that. So those are some of the, I think, trainings or things that we all could really learn and improve upon to really help to address these financial hardships among our patients. And in addition to that, I just want to quickly acknowledge really working with our community to address this issue is going to be huge, right? There are organizations, the whole social service system. There are tons of CBOs, community organizations that have been doing this for so long. I think within the healthcare system, what we need to do now as a whole is create better ties to the community, to these community organizations to say, hey, how can we work with you all? How can we learn from what you all have done and have set up to help our patients address some of these issues? Because it could be that there are existing resources in the community. We just don't know about it because we haven't asked. So those are just some of the few things that I think we as a whole, as a health system, but oncology nurses as well could do to really try to help some of their patients.
Thank you. And I think you touched a little bit on my last question with that last little piece that you mentioned, but do you have any other suggestions for additional resources, whether it's for providers or for patients who want to learn more about how to deal with or navigate financial hardships?
Yes, great question. I mean, I think for providers, but not only providers, I would just say for the healthcare system stakeholders, there thankfully are large national organizations that are really doing a great job working with patients to address this issue. So I would say, if there are opportunities for certain healthcare staff to just do a search, get on the internet and look, what are some of the organizations nationally or at the state level, even at the local level, that perhaps, right, could serve as resources for our patients, maybe reach out to them, make that initial contact and say, hey, this is who we are. We have a clinic, in this neighborhood. This is our population typically. Having those conversations can just lead to so much just because we're learning from one another about what services do they offer and, what kind of resources may be available. And for patients, I would just say if we, within the healthcare system, the healthcare team, can encourage them, right? Create those opportunities for our patients just to ask those questions of us, to be open to listening and hearing what they may offer. I think our patients then will then be more open, right, to ask for some of these resources and to be more comfortable, whether it's approaching the nurse, again, which is someone who I feel the patients often feel more comfortable with, or, the clinician themselves to say, what resources are available. So again, it's really about creating this system that really gives us the best chance for us to work with our patients so they can achieve that, that optimal health outcome.
Mateo, thank you again. This has been just a real pleasure, like I mentioned, and you have such a passion for this. I can hear it, and just the way you are encouraging our listeners to look in their community and find out how they can help their patients. And these are some really important tips and things that I agree with you. I think the nurse is one of the ones who might have kind of that inside reach to our patients, and the patients are going to be vulnerable with them and have these conversations. So I appreciate your time with us today, and just want to thank you for that and ask you if you have any final comments for us.
I just really appreciate this opportunity to chat with you all and also to present at this conference. We're really looking forward to it. As you said, nurses are such a unique group that I feel that they get it. They understand the issue and the importance of it. And so be able to have this kind of discussion and conversation with them, I think is really an opportunity for me as a presenter, as a researcher, to learn also from you all. So I'm very grateful for the opportunity, and I look forward to discussing this more.
Well, thank you for joining me today.
Be well.
Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you downloaded your podcast. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org. The ideas and opinions shared in this episode represent those of the guests and not necessarily ONS.